Okay, this section is about differential diagnosis in psychiatry and how I got to where I am now. I've been told that it's not clear what I have. It's not schizophrenia or bipolar disorder. It's something else which is possibly similar, but I'm going to use schizophrenia and bipolar disorder as an example for the arguments I'm going to put forward, because generally if it works for those, it works for everything else. The first thing I looked at in my research was brain structure and function in these diseases. In schizophrenia, the relationship to symptoms, miswiring, overactivity, and underactivity with affective and psychopathological symptoms, positive symptoms, and negative symptoms, generally speaking, is the correlation in that miswiring is responsible for psychopathological symptoms, overactivity is responsible for positive symptoms, and underactivity is responsible for negative symptoms. Overactivity and underactivity are responsible for the areas which result in brain loss. People with schizophrenia lose 1 to 9% of their brain tissue, which can be higher with substance abuse. Examples of their brain tissue each year in several different regions of the brain, mostly in the left side, with the exception of the amygdala, which happens in both sides. The consensus about what kickstarts the disease appears to be a neuron misfiring and getting stuck in the prefrontal cortex of the brain. The wiring of the inner ear is also different in the schizophrenia spectrum disorders. He explains bipolar disorder mostly uses brain tissue on the right side. Schizophrenia has an abnormal left temporal lobe where the brain tissue was lost. Teenage males with an abnormally small hippocampus are predisposed to developing schizophrenia, whereas teenage females with an abnormally small hippocampus are more likely to be predisposed to developing bipolar disorder. The next thing I looked at was the DSM-5 definition of schizophrenia and bipolar disorder, which is that it is not a mental illness, it is a neurodegenerative idiopathic brain disorder, similar to dementia or Parkinson's. I came to the same conclusion as the DSM-5. That stands for the Diagnostic Symptom Manual of Mental Disorders, and is published by the American Psychiatric Association. The third thing I looked at was the pharmacokinetics of the drugs used to treat these disorders. You've got antidepressants, antipsychotics, anti-anxiety drugs, and then there's the mechanisms of action. Agonists, which increase the amount of chemicals produced on the receptors of the binding sites, antagonists, which decrease them, and partial agonists, which have fairly unique properties but still increase to a degree. And then there's some unique ones like lithium and agomelatine. After looking through these things for several years, I came across adjunctive therapies and add-on treatments, as well as looked at drug trials for new experimental drugs that are being trialed, and I looked into these. I saw clinical trials for glycine type 1 transporters going on. I would potentially have to wait a few years for any product to become commercially available, so instead, I bought some crystalline powder, otherwise known as sarcosine, from a US-based sports supplement store, which is a nootropic drug, then used food capsules to put the powder in, which I also ordered online. I also saw that repetitive transmagnetic cranial stimulation for schizophrenia is ongoing in a trial in Western Australia, but it's already commercially available and cleared by the health boards in Canada and parts of Korea. Western Australia was a couple of years behind the eastern states in Australia for mental health as a whole, and Australia is several years behind the rest of the world, unfortunately. I read several papers with add-on therapies and tried as many as I could with my resources. I collected a list of 4 or 5 meta drugs which I thought might be the most effective. I was unable to get them prescribed to me apart from minocycline by public health system psychiatrists, but it was an interesting exercise anyway. As a doctor, I was seen was not allowed to prescribe specialist drugs. These were minocycline, nicotinic agonists, recombinant human erythropoietin, and intranasal oxytocin. EPO is a chemical found in the back of the deep brain associated with higher cognitive function, and the levels lower in schizophrenia. It is produced by the kidneys. Interestingly enough, lupus erythematosus attacks the kidneys and causes psychiatric symptoms, possibly meaning that impaired kidney function is a biomarker for psychiatric disorders. After doing all this research and also looking into another clinical trial for GE Neuro, which I'll get into later, and human endogenous retroviruses, I came across differential diagnosis, which is disorders which could possibly be a psychiatric disorder with similar symptoms. During my research, I came across information about Toxoplasma gondii, which can create a syndrome clinically indistinguishable from psychosis. This made me ask, what if there are other conditions like this? So I got NHS bloods done for Toxoplasma, which came back negative. I looked at a paper on complementary and alternative treatments for schizophrenia, bipolar disorder, and akathisia, which is an extrapyramidal side effect of the drugs used to treat these conditions. This paper looked remarkably like a list I used for alternative treatments for Helicobacter pylori, a stomach infection. I came to the conclusion that many psychiatric disorders are likely manifestations of infectious diseases, or involve the immune system in some way. This would make sense based on a recent paper published about Alzheimer's disease and about how the amyloid plaques found in the brains of people with Alzheimer's disease show the DNA of the herpes virus in them. So, in this list of things and alternative and complementary treatments for extrapyramidal side effects, schizophrenia and bipolar disorder treatments, many of these things are antioxidant, antibacterial, antifungal, antihistamine, antiparasitic, antimicrobial, and anti-inflammatory. It even has hyperbaric oxygen treatment, which is considered one of the gold standards for treating infectious diseases, as bacteria cannot survive past 30 atmospheres of oxygen. Many of these treatments are already cleared by health boards in India and China and are regulated and used in medical practice for mental disorders. It occurred to me that these people must have infectious diseases, in some cases, and this was confirmed when I saw a Japanese paper on minocycline being used to treat schizophrenia, and it occurred to me how people can't connect the dots in this way. 80% of the body's serotonin is stored in the bile gut. Treating leaky gut has been shown to be useful for depression, and SSRI antidepressants have been prescribed for people with an off-label treatment for IBS or irritable bowel syndrome. So, I worked backwards through my life, through all my medical records and the places I visited, and I started to do a differential diagnosis. What I found was that all of the organs in the body have a two-way feedback with the brain, which you should look at and consider seriously, and look at as many disciplines as possible of medicine with integrative psychiatry as possible. The liver is related to acute intermittent porphyria, the intestine celiac disease. The upper respiratory tract is autoimmune disorder PANDAS. The cardiovascular system is carotid artery stenosis. I looked at physiotherapy, neurology, psychiatry, autoimmunology, cardiology, psychology, microbiology, dentistry, autoimmunology, orthomolecular psychiatry, nutrition, hepatology, and endocrinology. Now I'm going to give a short list of disorders which can create syndromes which are clinically indistinguishable from psychiatric illnesses. The long list is a lot longer and contains a lot more obscure conditions and a lot more infectious diseases. I came across 3 clear world leaders when I was doing my research and liaising with people to get tests done and following research. The first was the Stanley Medical Research Institute in Maryland, USA. I initially came across SMRI's work when looking at repurposed drug databases for schizophrenia and bipolar disorder. I later found out that they're working on analyzing genes associated with the poor brain structure that could predispose or be caused by psychiatric illness. They have the largest collection of schizophrenic and bipolar. They have the largest collection of schizophrenic brains in the world, and using supercomputers to break down the entire brains into slices and analyzing the genomes associated with the brains. The genomes associated with brain structure and function. I talked to Fuller Torrey, who is the Associate Director of Research, who forwarded me to some people in Australia in toxoplasma and infectious disease research. And he has his own interpretation of integrative psychiatry. However, he only looks at 2 or 3 disciplines of psychiatry, and he's got his own theories, but I feel it's fairly limited because he looks at toxoplasma being responsible for psychiatric symptoms. However, if you look at the wider picture of microbiology, toxoplasma is actually quite rare compared to other infectious diseases which can cause psychiatric symptoms. Much more common pathogens that can cause the same problems, such as Babesia and Bartonella. A monothesis for schizophrenia is setting itself up to fail, I think. Most integrative psychiatry fields look at 2 or 3 other disciplines of medicine, but you need to look at a lot more than that, I think, because there's always more to learn. I exchanged emails with Fuller Torrey, and he gave me some contacts of research for the infectious diseases in Australia, as I said. Then I came across Belinda Lennox's work from the University of Oxford. She was researching a new condition, anti-NMDA encephalitis. I exchanged emails with her, gave her some ideas for her work, and she was telling me that she was starting research with intravenous immunoglobulin exchange to get the antibodies out of the blood. I said that she should apply for a research grant from SMRI, who are patrons to other world leaders, and she said that she already had. The third world leader that I came across was working on human endogenous retroviruses. First, I'm going to explain what this is. Human endogenous retroviruses, or HERVs, are viruses that are tied to the human genome through millions of years, inherited into the human genome millions of years ago in primate evolution. They're viruses that come from different animals. They're mostly harmless. However, GU Neuro Switzerland thinks differently, or Geneva Neurology. They've been researching the link between HERV type W and type K in relation to multiple sclerosis and psychiatric disorders. Their pipeline product right now is focusing on multiple sclerosis. After manufacturing monoclonal antibodies for type W, they conducted the first successful research test ever done in relationship to MS, and found that the antibodies slowed the disease progression. They did some early trials on schizophrenia, and I contacted in French the University of Paris, where the trials were going on, to inquire about applying for the further clinical trials. However, due to lack of funding, the trials had stopped past phase 2. GU Neuro funded SMRI funded the stage 1 and 2 trials, and it appears that the money ran out due to lack of interest from other parties. I contacted people from Switzerland, the UK, the US, Australia, France, and Czechoslovakia. Before I finally got what I was looking for. Seropositive for Borrelia band 17 and Bartonella henselae. Just correcting an earlier error, the DSM stands for Diagnostic and Statistical Manual for Mental Disorders.